Hello, I'm Dr. Zachary Sellers, pediatric pancreatologist and director of the Stanford Children's Pancreas Program. On behalf of my co-authors and the NASPGHAN Pancreas Committee, I'm excited to tell you about a new resource that we feel will help provide expeditious and evidence-based acute care for children with acute recurrent and chronic pancreatitis. Pediatric acute recurrent and chronic pancreatitis are debilitating diseases that incur an estimated $60 million in direct medical costs per year. Because recurrent pancreatitis occurs less frequently than adults, many urgent care and emergency department providers are not aware that kids can get pancreatitis and may not be familiar with the differences in how they present. This may be exacerbated by the fact that over 80% of children in the US are seen in non-pediatric emergency departments. Our goal was to create a resource for children with acute recurrent and chronic pancreatitis that would help facilitate timely, guideline-driven care for acute pancreatitis episodes, regardless of the initial location in which they sought care. We leveraged invaluable relationships between physicians on the NASPGHAN Pancreas Committee and leaders at Mission Cure, the National Pancreas Foundation, and Rebecca's Wish. After many discussions and iterations, we developed a one-page document called the Pediatric Pancreatitis Passport and Action Plan. This document is split into two sections. The first has basic information about the patient and their medical provider. In particular, the patient's primary gastroenterologist or pancreatologist can fill out pertinent details about their pancreatitis history that other providers should know. For example, specific pain medications that the patient may respond well to. The second section provides evidence-based and expert guidance to help those that may be less up to date on management practices for treating acute on chronic pancreatitis in children. Likewise, there's a link and QR code that directs providers to additional resources on pediatric pancreatitis that are located on the NASPGHAN website. This passport is freely available to providers and families to fill out online and or download from the NASPGHAN website. On the same website, we have also included sample language for families on how they can introduce this to acute care providers. We hope this resource will be useful to facilitate timely, evidence-based care for children with acute on chronic pancreatitis, regardless of the location in which they present. We also hope our experience working closely with foundations and patient advocacy groups to generate a patient resource will also serve as a model for similar future resources for all persons with pancreatic diseases. If you have any questions about this exciting new resource, please reach out to me or any of my co-authors. Thank you.